So the flow of this session, there'll be a few minutes now for your questions to Marie-Paule, and then we'll have more discussion with both of the keynotes a bit later. I wanted to say, Marie-Paule, really nice to see what's been achieved over the last decade, and for us to hear about the impact and the way patients are involved, and how some more of us might get involved on the national levels, but also to hear about the commitment to ongoing engagement with patients going forward. So I'm sure there are lots of questions. Can I ask you to raise your hands if you have questions? And I'll take, I think, I might have to wait for people to have a think a bit more. So I think we'll start with Ofra and then Orijit. If you could both ask your questions, and then Marie-Paule can address them.
Mrs. Kieny, thank you for your lecture. I was very happy to hear what you have just said, because whenever I applied from Israel to WHO, they always refers me back to Ministry of Health, the Israeli Ministry of Health. And I was very, very upset with that, because we do think that patient has good contributions. And I'm very happy, and I would like to know how I can contact your team so we can promote such things. And I thank you very much.
Thanks a lot. If I can just quickly answer on that. Of course, WHO is not an organization which works with direct contact with individuals. We work with institutions. So I have had, not talking about patients, I have had messages asking me what to do in case somebody was bitten by a dog. The dog might be rabid. What they should do. So this is clearly not what we can do. But what we want to engage with patient and patient organization is on the policy design and on the design of organization. So my suggestion is really, Nitita is still here, that she's the secretary for the Patient Safety Network and other partnerships. So she will be very, very happy to relay your questions, certainly.
And Orijit, if I could just ask people to say their name and their institution as well.
Orijit Bamrungsakul Sawat from Heart to Heart Foundation, Thailand, and also partly I work with the National Health Security Office in Thailand as well. I agree with you in the patient-to-patient safety. I get the point that it's not only the accessibility, but it's mean quality and standard. And in this case, in Thailand, we're talking about the standard and quality. That means if we have the patient participation, in order to set the standard quality that is to the patient, not to the hospital, that will be better, right? And it's happened in that way that if we have a advocacy forum that you include patient and healthcare sector and also some experts in order to develop some kind of easy standard and quality that is satisfied all the stakeholders, that it will be implementable and it will be feasible for everyone. Do you think it's possible in that way?
No, absolutely, certainly. And Thailand is on the forefront of this debate about quality improvement through notably the discussion on a new vision on human resources for health. And this goes very much towards quality of services and towards what in Thailand is called the transformative education for healthcare workers. So this is also, I take this opportunity also to say that we would like to engage with the patients' organization community on this work that has started now on trying to define a new vision and strategy for human resources for health. So this is something that is undergoing right now under a partnership which is hosted by WHO, which is called GWA, the Global Health Workforce Alliance. So there are quite a number of different working groups looking at different aspects. One is in education, for example. The other one would be on quality. And I have insisted that we should have one of the working streams would be about engagement of non-healthcare professionals, because this is absolutely important that we are not looking to the reform of healthcare, of human resources for health, only from the eye of a health professional. We need to have the views of patients, of their family, of a social sector, because clearly healthcare professionals are very important, but they are not the end of a story. So this is also something that we would very much like to engage with you.
Any other questions? Yes, we have one
It was
there. Yeah. Carry on. Yes, please.
it was good to hear your push for more patient involvement, but a very practical issue of how that occurs from a real-life example. We work in Eastern Democratic Congo, where we provide antiretroviral drugs for patients with HIV infection. These drugs are provided without charge. It's standard of care by international standard of care, not by WHO standard of care. When we try to implement that, the patients are very well aware that there is better therapy available, which we can provide. They communicate with the physicians, the indigenous leaders, who then communicate with Kinshasa, Ministry of Health, who then are told that it's in violation of WHO guidelines. Now, here is an example of where patients are demanding and know their rights to better health care. But WHO dominates this working through the Ministry of Health. How do those people get access to, I mean, this is not a question about rabies, this is a question about policy. How do they get access to being part of the conversation with WHO and Ministry of Health, that they know what is their right to health care, but they're not receiving it?
Well, usually this would be either through government organization or through NGOs. Really, civil society is the best way to hear these concerns of patients and to bring up in the debate. At this point, I'm not aware of more details, so I cannot tell you more about that. But again, this is something that we'll be certainly happy to discuss.
Okay, so one more question and then we're going to move on. So, Rebecca, I think. Oh, Rod.
My name's Rod Mitchell. I'm representing the International Genetic Alliance. It's really for clarification, and it's about the communication to you by the patient organizations, or should we in fact be routing all our communications through the International Alliance of Patient Organizations? I appreciate that you have different committees and different groups and you seek representation, but generally speaking, would it be better that we make our connections through IAPO or direct with the WHO?
Well, it depends on what. I think it makes it easier if when patient organizations speak from one voice, and IAPO, especially because IAPO is an NGO in official relationship with WHO, makes it easy because also IAPO has a voice at the World Health Organization. But if you think that there is something that has been not considered, has not been given due attention, then you're welcome to contact us directly, not going through IAPO.
Okay, I know there are other questions. If I could ask you to hang on to those and we can come back to you in the discussion. So again, to thank Marie-Paule Kieny.